Dr. Schwarz, can you explain what a CIT treatment is?
CIT stands for collagen induction therapy. That means the producing of collagen within the skin.
And you can do that with the derma roller?
The derma roller is the device that I use to achieve this. It is a small apparatus needling the skin.
How much collagen can actually be triggered with the derma roller?
At the beginning I was skeptical and did a blinded study, and the amount of collagen within the skin samples was twice as large as before rolling the skin.
And what medications are responsible for such an immense increase?
No medication at all. It is the effect of the needle and that micro scarring that produces the effect.
Is there an explanation for this phenomenon, Dr. Schwarz?
A real explanation I don't know. It must be some kind of scar induction that leads to the effect, but that is point of further studies.
It sounds like a miracle.
Well, miracles are something in religion, not in science, so it's just not known how it works exactly.
And does the treatment hurt at all?
No, it doesn't hurt at all. At the beginning there is an anesthetic cream applied, and that cream will make the skin numb. So what the patient feels is just a small trickle or a prick, but not more.
And how long, for example, would a treatment take?
The most of the time is for the effect of the anesthetic cream. That takes half an hour. The treatment itself is, let's say, for the cheeks, it's 15-20 minutes.
And how high is the blood loss with this sort of treatment?
There is no loss of blood at all. I have to penetrate the skin. That means there are small, like when you puncture yourself with a needle, there is a small point of blood, but the blood is not, you're not losing blood.
And how often do you find that you have to roll over one part of the skin?
It is very important that the micropunctures are very, very even. That means 10 to 20 times each part of the skin must be touched. So 250 micropunctures per square centimeters is the goal.
How many days after the treatment should the patient stay at home?
For the first and second day, the skin is a bit red. It looks like a slight sunburn. But then he can leave home as he likes, and he can also apply some kind of camouflage or makeup.
What side effects does a CIT treatment have, and how long are the micropunctures open?
The skin is penetrated. That means potentially it can be an infection. I always do it in the operation theater under sterile conditions, so that I haven't seen any infections yet. The other, at least theoretical, risk is keloid scar formation, and each patient is asked if he ever developed excessive scarring.
Dr. Schwarz, do you also do laser treatments?
I did in the early days of laser. I did laser treatment, but I have stopped because the laser, it's the effect of the derma roller is the same.
So are you saying that a small device like the derma roller is in fact better than laser?
It has got certain advantages, what convenience and the fact that it is not abrading skin, that it preserves also the good parts of the skin. That is the main advantage of the roller.
And how often can you repeat a SIT treatment?
As there is no abrasion, no loss of skin, it is the formation of new cells. The rolling can be repeated as often as you like, but as it takes 6 to 8 weeks to develop the effect, there is no reason to repeat it earlier than these, say, 2 months or 3 months.
What other uses does the derma roller have?
The application of the derma roller is in its beginnings, so few things are just developing. For instance, at the moment I'm making a study on stria, on distanced, on stretch skin marks, because I've seen that these stretched skin marks are becoming less wide, and what I've also noticed is that pigmentation that it was disturbed is becoming more even, but that is only beginning of checking all possibilities and indications.